Hi everybody, my name is Dr. Gholampour. I'm the owner of Strength Spine Chiropractic here in beautiful Tampa and St. Pete, Florida. What we're going to talk today about is how we would treat migraines and headaches. The big focus of today is one, utilizing soft tissue techniques, utilizing an IASTM tool, and then how we would apply kinesio tape, and then applying the Stopain topical migraine and headache clinical as well. So the biggest thing when we are working with migraine and headache patients is that we have to take quite an in-depth history to make sure we understand why exactly this patient is experiencing this headache or migraine. There are a plethora of different types of headaches and migraines, and that is why asking the right questions and interviewing your patient to understand what potential triggers might be causing this is so important. So with us, we like to sit down and explain when we do have a headache patient that we will be doing a lot of history taking and examination to ensure that we have the right cause and how we can help them identify what might be causing their symptoms or potentially triggering their migraines. A lot of the common things are nutrition, nutrient deficiencies, stress, work-related ergonomics, as well as there's musculoskeletal causes of headaches. Here in this office, we see more of the musculoskeletal-based or ergonomic-based headaches and migraines, so that's where we are big on the education and the rehab and exercise portion of this to ensure that they are addressing the potential root causes of those headaches and migraines. In this setting, sometimes it's not ideal because as you can see, we're located out of a sports performance facility. There's loud music, bright lights, and people hitting baseballs. When you're having a migraine or a bad headache, that might not be the best thing, but we do have a private room which we, get them to relax a little bit so we can help with that. In our office, some of the best things that we utilize is chiropractic manipulation, soft tissue techniques, whether it's using our hands or the IASTM tool, which we'll discuss in a second, taping to try and help offload or desensitize a region, as well as acupuncture and dry needling. After we address the musculoskeletal component and talk to them about how they can have resources at home and do certain things to try and help reduce their symptoms, every single headache and migraine patient will leave with one of these. So this is the Stopain Migraine and Headache Topical. This is a very powerful product that Stopain has created. And with this, it has 4 homeopathic ingredients, so all natural ingredients, no funky dyes, no funky smells. All you do is you take it and you apply it to the back of the occiput or towards the base of the skull and a little bit closer to the ears. And within 30 minutes, you should see significant relief of your symptoms. And if you don't, what we recommend is after 30 minutes, apply another packet and go from there and let the Stopain do its work. Again, there's no funky smells, it's not super minty, there's no crazy dyes or gels in there. And with this is a natural product that a lot of our patients have gotten significant relief from. So let's get to the treatment of how we would treat headaches. What we do is utilize a little bit of emollient. We're just gonna use the Stopain gel here. And what I'm gonna do is work primarily through the levator scapula and the suboccipital musculature, as well as the cervical musculature. The biggest thing here is that I am not trying to go too crazy utilizing the tool. So I've got my instrument assisted tool. There's a million different brands out there. Technique wise, all I'm doing is scanning the area to determine if there are any areas that might be a little tighter or there might be a little bit more fascial restriction than others. And one tip is, he's got short hair just like me, so this makes it great, is when you are working in this area, try and work up to the very base of the skull, right? So this fascial connection here coming from this cervical musculature all the way up, this will help give a lot more relief to some of those headache patients. It's kind of a unsung hero in treatment of headaches. Is if you rub this on the back of your head, you will notice that you kind of feel some good relief after working through that area for a little bit. Feel okay? Right, so I'm not going too crazy. I'm not trying to press very hard with this. We are going to go until we see a little bit of petechiae or some of the capillaries starting to be broken up and exposed. With this, we can also start to get a little bit more active. So Quincy, if you could sit up nice and pretty for me, and then go into the best double chin you can for me. Yeah, there you go. Good, and then repeat that 5 times. So here we're utilizing the cervical Mackenzie retraction to try and help stretch out those suboccipital muscles and mobilize the cervical spine, which can be a common cause of headaches, especially if you're sitting at a desk all day. Not bad? Okay, so one thing is after we get the base, then whether you use your hands or utilize the tool, we're gonna use the Stopain Migraine and Clinical product. Again, these packets are lifesavers. When I travel a lot for sporting events or for fun, I make sure that I bring 2 or 3 of these with me at all times, just to make sure that if I start to experience any headache symptoms or anything after long nights of having fun, that I have something that can give me great relief. Feel okay? So I'm going to spread this out nice and even across the base of the skull. Make sure it's all the way in there. And again, when you're working with female patients or people that have long hair, one of the best things I ever learned was go to the dollar store and grab a bunch of ponytails and hair clips. That way we can get people's hair out of the way, because a lot of the times you will get into that hairline with this. Good. So, and one of the best parts about utilizing this, especially being in a more sports-based office, we utilize a lot of different taping techniques. The nice thing about these topicals is that we can apply the tape over it, right? Or what you can do is, if it's not an area where you use the topical, you can tape and then spray afterwards. The biggest thing is, if you use the gel, you do have to give it a little bit of time for it to set into the skin, so the adhesive of the tape can make sure it sticks. So we're going to give this a second here and then start taping. So we've got a strip of Kinesio brand tape here. Again, excellent quality brand of tape. What we're going to do is tape the levator scapula, which is a common trigger point in neck pain and headaches. And with this, the goal is to try and help relieve the overactive muscle using the tape. So what we're going to do is we're going to tape from distal to proximal. Right? So when it's overactive, typically we tape distal to proximal. So that would be from down here all the way up towards the base of the neck. So what I want you to do here is, you're actually going to turn your head this way and come here. So take 2 or 3 fingers, rip there, right, to create your anchor, right down. Again, we're going to go right over that muscle. And so I'm going to apply about 10 to 35% of tension, right? So about 100%, 50, and a little less. So go ahead and bend your neck a little bit more, and then I'm just going to lay it right over the muscle, right? And then paper off tension for the anchor at the top. And then again, we are going to use our fingers to help with making the adhesive stick. So it is heat activated, so we do try and make sure that it is fully rubbed in. There's no wrinkles, no funky spots, so we have the best chance of this tape sticking. Good, and come up for me. Biggest thing here is we use a combination, a multimodal approach when we treat our patients. After the very in-depth history and exam, which patients are always excited that their doctor is talking to them and asking questions, a combination of hands-on techniques utilizing different modalities such as the IASTM, using tape, and then teaching quality rehab is an excellent way to try and help your patients with their migraines and their headaches. One thing in this office that I always preach, and our patients have absolutely appreciated because they've seen the results themselves, is utilizing all the different Stopain products. Again, today we highlighted the Stopain migraine, headache, and clinical product. The big thing here, apply it to the base of the neck. Keep this in your office, provide it to your patients when they do have a migraine and headache, and I promise you, they will remember that time that you gave them that stuff that took their headache away when they couldn't come in to see you.